Ethical Issues Related to Nursing and Hospice by Erin Schweiger. Hospice is a philosophy of care that values life from the moment it begins to the moment it ends. The individuals that are immense advocates for this philosophy are the hospice nurses that aid in caring for these patients. Hospice nurses live by this philosophy. Hospice nurses provide a huge benefit to patients, but there are many ethical issues that the nurses must deal with and are still attempting to find solutions to. It is a delicate matter for nurses to work with patients that are at the end of their life. The definition of ethics, as quoted by the Merriam-Webster Dictionary, is that what is good and bad, and with the moral duty and obligation to deal with it. As can be expected, hospice comes with a great moral duty to treat patients with the best possible care and always acting as the patient advocate. Ethical issues in hospice care appear to be abundant because end of life seems to bring a lot of uncertainty of what is wanted and a total whirlwind of emotion for the patient that they may not totally understand. Nurses are trying to be ethically competent with the patient, but day-to-day changes in what the patient may want or what the patient is feeling makes that even more difficult than it already is. The nurses in the hospice care are always there to keep the patient's best interests at heart, but all the while must make sure that the care given is the best care that the patient can receive. These ethical issues come into effect before the patient has even received hospice care. Some patients will greatly benefit from end-of-life care, but do not ever receive this care because their medical issues do not qualify them. Nurses go through the ethical dilemma of denying patients who might have a prognosis of 6 months or less the relief that they need because they do not meet the medical qualifications. Nurses' sole responsibility is to promote health, prevent illness, and alleviate suffering. One can imagine the great distress and guilt it must cause a nurse to deny a patient in need of this care. These issues arise before the patient has even received hospice care. However, after the patient does qualify for hospice care, nurses are there as emotional support to make sure the patient is knowledgeable on the care that would benefit him or her in the best way possible, and that the patient is fully educated on their prognosis. According to Lockman, patients would usually prefer that this information be provided by their physicians, not the nurse. This poses the ethical issue of whether the nurse should allow the patient to receive information from what they feel to be a more knowledgeable source, or whether the nurse should provide the proper caring interaction that is needed. Hospice is not cheap by any means. It is a holistic approach of end-of-life care that involves interdisciplinary services, and if the patient cannot afford all of these services, the nurse now has to help the patient pick which care options are most important. This is just another strain put on the nurse with denying patients what would be best for them purely based on cost. Alternatively, it is beneficial to the patient to have a nurse that has their best interest in mind and is able to assist them with working around these cost barriers. This duo will now begin to deal with and overcome issues that arise once in hospice. These struggles are dealt with one day at a time, but sometimes pose a variety of problems for the nurse. In hospice care, the nurses form a bond with their patients in which they deal with these trials and tribulations as a team. Though the nurses have to deal with a multitude of struggles to maintain within their ethical bounds, they also act as an emotional stronghold for the patient, and that is something for the nurse to hold close to their heart at the end of the day. Thank you.